Now I want to talk about Kamala Harris. She was in Wisconsin. No one cared, but she was in Wisconsin talking about health care and affordability and helping out senior citizens and the Biden administration's assistance that they have provided to improve senior citizen care, long-term care. Miranda, I hope I say your last name correctly, Spindt from Wisconsin Institute for Law and Liberty is standing by to talk about what the reality is of what the Biden administration has proposed and what it's going to do in Wisconsin if it takes effect. It's great to have you, Miranda. Thanks for joining me.
Yeah, thank you for having me on, Vicki.
So you have this is an analysis you did. When the Biden administration claims that it is going to improve quality of care by increasing minimum staffing levels and requiring there to be licensed nursing staff, a minimum amount of licensed nursing staff at every single facility, how many Wisconsin nursing facilities are likely to be impacted in a way that potentially puts them under?
A lot of our long-term facilities are going to be impacted by this. So by setting this minimum staffing level, which is higher than almost every other state standard in the nation, what you're doing is putting a heavy burden on these facilities, which already can't find enough staff. In Wisconsin alone, from a 2022 report, we have almost a 30% vacancy rate in our caregiving positions in these nursing homes and other long-term care facilities. And by setting a staffing floor, like, where are you going to find these people who are going to fill these new required positions? It's going to be devastating for a lot of facilities who likely won't be able to meet these standards. They'll likely have to shut down. And then when you shut down more facilities, that's going to make access more difficult. That's going to drive up costs. And that's going to not only, obviously, these facilities that are closing have been impacted, but the families and patients that have to now deal with the consequences of that action.
So these are, would this be Medicaid only, or would this be a rule that would also apply to any kind of nursing care facility, a memory care facility, a private facility, a Medicaid funded facility? How would it work?
So it does apply to I believe 80% of nursing homes and long-term care facilities that get Medicaid funding. That's who this applies to. But that's a lot. A lot of our seniors rely on this. About 30%, a little bit more than 30% of Medicaid funding is for long-term care costs for seniors who are taken care of. And this is going to impact a lot of nursing homes that rely on this funding.
So so private, or, I mean, it's not just like a government nursing home. It's if you take Medicaid money. So if you take a patient who's on Medicaid, then you are covered by this rule. So this is like most nursing care facilities in Wisconsin. And we've got an increasing population of older people and a decreasing, or at least not it's not keeping to parity with the number of people who are going to be soon or are already over the age of 65.
Absolutely right. So actually, an interesting statistic here is that the number of seniors who are going to be 65 years or older is going to be higher than the number of children who are 18 years and younger by the year of 2035. So within the next decade, we're going to have more seniors than we will have children. And that has incredible long-term effects. We're going to have an almost 20,000 shortage of registered nurses for caring for our seniors by the year 2040. And there's just not going to be enough people to continuously meet this demand that's growing in our country and in our state. Wisconsin especially has an issue with our aging population. We have a lot of people who are aging, getting elderly, and this is something that's going to be a consistent struggle for us to keep up with. So we're already not finding enough staff. And an interesting thing about this rule, which just goes to show how flawed it is that we have exceptions for rural communities, which are struggling with finding enough staff due to their locations, and also have more elderly populations. There's a 3-year leeway time for them to be able to comply with this rule, and there's also an exception for areas that are facing healthcare worker shortages. And when is that never not going to be a problem? There's always going to be rural communities and areas that are struggling with finding enough healthcare staff, and it's only going to get worse. So even though this rule seems to be trying to be helpful for these communities, it's really not. Having this rule is going to be such a burden on so many different families and facilities throughout the state that we just can't meet this type of demand.
So we're 20,000 registered nurses down, and that's for nursing care facilities. That's for like for elderly people. We're 20,000 registered nurses. What are we looking at in terms of nursing support staff, like CNAs?
Sure. So that 20,000 number is for the year of 2040 is when we expect to see that gap.
Okay.
Currently today, we have about a little over a 27% gap in caregivers overall, and for nursing assistants, that is of 28%, a little over 28% that we of positions for certified nursing assistants that we aren't able to fill currently.
So 1/3, and so you have the estimated number of actual human bodies will be down in 2040, but currently it's 1/3, approximately one third of facilities can't find enough registered nurses, and approximately the same number cannot find CNAs. And what are we doing in Wisconsin to try to make nursing and nursing assistants more popular? Where are we going to get these nurses? What are we doing to try to create the conditions where we have made Wisconsin the most welcoming state to study nursing?
Mm-hmm. So one solution that we talk about in our report is that there is a proposal that was released in 2019 that would lower our CNA, Certified Nursing Assistant training required hours from 120 hours to 75. So 120 is a state rule, but 75 are the federal standards. There are 19 states that use the 75-hour federal requirement, which include Minnesota, Michigan, and Iowa. This would be a great way for us to help attract people towards becoming certified nursing assistants, which we need desperately in our long-term care facilities. Unfortunately, Governor Evers vetoed this bill in 2019, but then ironically, during the pandemic, he implemented that exact same rule, lowering it from 120 hours to 75 hours during the pandemic as an emergency rule. And it was good enough during the pandemic, but he let it expire. And this is a solution that we have used in Wisconsin. We used it during the pandemic. It was good enough during a health crisis, and it should be good enough now. And this would obviously be a great way for our state specifically to at least get the ball rolling in helping people and encouraging them into entering them.
That would just make us competitive in terms of training with other states, but that doesn't, that's not a way to attract Wisconsin ought to be bending over backwards. Our population is aging. Young people are moving out of Wisconsin. Not only is our population aging, but one of the reasons is because we do nothing to try to keep people here. And at the same time, our healthcare costs are exploding. We didn't talk about that. Kamala Harris didn't talk about that. The costs are exploding. You mentioned 30% of Medicaid money now is dedicated to long-term care for seniors. By the way, I'm not bashing on seniors here. 30% is dedicated to long-term care for seniors. By 2040, what's that going to be? 40%? 50%? I mean, the budget, the Medicaid commitment from the states is already eating up gigantic portions of the budget. I remember when Scott Walker was worried about this, and he said, in a few years, it's going to be half our budget is going to be taken up by our commitment to match Medicaid money. And so ever more dollars are going to have to be committed. And then, of course, you're going to see the pressure to expand the amount of money we commit to Medicaid because the senior citizen care is eating up the proportion of Medicaid that used to be going to non-senior citizen care, right? So this is, it's a recipe for disaster. It's a recipe for people just being abandoned.
Yes, absolutely. And you mentioned the Medicaid spending. With this rule, again, with facility closures, that's only going to make our facility care more expensive, which is going to impact our Medicaid spending. And even if we don't increase our Medicaid reimbursement rates, then that's just going to be even more facilities closing because their costs are going to increase still. If families aren't able to afford that, they have less patients going to those facilities, and even more facilities be closing, even more prices increasing. And it really is a never-ending cycle. And we need better policies that rather than having overarching federal regulations like this rule that comes in and creates a federal one-size-fits-all that clearly does not actually fit all, especially not here in Wisconsin. Those aren't the types of things that we need to be doing. The federal government does not need to be coming in claiming to be solving all these different issues for us when they're not. But we need our people to be rolling back these policies, to be reducing regulations like the 75-hour requirement. And it makes Wisconsin competitive, and there's other ways for us to do that. And it is a way to incentivize people to enter that field, because that's a burden that people have to take on when they know that they have to do 120 hours here versus 75 in Minnesota. So there are lots of ways to, just reduce regulations to encourage people entering the workforce, and to ultimately, by increasing the workforce, making it available for facilities to hire these people so that quality can increase, which is the goal of this rule at the federal level. But obviously, just mandating having more workers is not going to create that workforce, which is what we need to be focusing on.
Miranda Spindt, thank you very much for joining me on the program. And everyone should probably check out this will report, because we're all going to be there someday. In my case, sooner rather than later. will-law.org. We'll be right back.